You're watching Fox 40.
Even if you're making healthy diet choices, there are still foods that can trigger inflammation. We're getting a doctor's guide to reducing chronic pain up next. September is Chronic Pain Awareness Month, and for those who struggle with daily pain, nothing is more important than finding ways of coping without narcotics. Dr. Sheetal DeCaria joining us now with a guide to reducing chronic pain. Doctor, thank you so much for being with us. Such an important topic, because as we tend to try to eat healthy to help ourselves feel better, sometimes we may not know that the food that we're eating to be healthy could be harmful to our bodies. So let's talk about the foods that could be causing some pain for us. And let's start with beer.
Yes, so some individuals, particularly those suffering from gout, which is an inflammatory type of arthritis, they can actually, when they drink something like beer, lead to elevated levels of uric acid and cause swelling of their joints, usually the big toe joint, but could be other joints as well. Alcohol can play another part in people that have chronic alcohol use. They can actually get nutrient deficiencies that lead to neuropathy or a nerve pain. This is like numbness and tingling in your hands and feet. So if you are a chronic drinker and you have these symptoms, talk to your doctor about getting some of these vitamin levels looked at.
I also want to talk about nightshade vegetables, because we think we're eating vegetables, so it's good for us no matter what. But there are this group called nightshades, and that includes foods that we tend to eat every day, like tomatoes, potatoes. Who would have known that these could cause problems?
Absolutely. So tomatoes, potatoes, eggplants, peppers, these are the nightshade vegetables, and there's a few others. But the idea is that for many people, these are actually very healthy. But in some individuals with autoimmune conditions and some type of inflammatory arthritis, such as a rheumatoid arthritis, they can actually trigger inflammation in their joints and increase pain. So it's something to consider if you have any of those conditions, eliminating for a period of time and seeing if your symptoms improve. And if they don't change at all, you can continue to eat them.
Okay, let's talk about sugar and refined carbs. We know that we should limit these. We've been told that by many health experts, including yourself. But what could happen?
Animal and human studies have shown that eating sugar, refined carbs, these kind of foods, increase elevated levels of CRP, C-reactive protein, which is an inflammatory marker. And they've shown that when you remove these things from your diet, you actually reduce levels of inflammation. So it is been proven that actually we do get inflammation when you eat these.
Especially in your joints, right? This is a big problem for joints. Let's talk about pasta. This can lead to a lot of belly pain, some stomach problems as well. And we're thinking particularly about the gluten in them.
Reports actually estimate that about 10% of individuals actually have some form of gluten sensitivity. And for many, it can manifest in different ways. You may get something like bloating when you eat gluten, headaches, foggy thinking, joint pain is another big one. And so for many people, they're sensitive to gluten and have no idea. So it's also another thing you want to eliminate for about 21 days, see if your symptoms disappear, and then reintroduce that food.
That's a good point. So instead, we should just eat the rainbow, right?
Absolutely, yes.
A rainbow of good things.
Yes, eating whole foods, a lot of vegetables, fruits, trying to remove those processed foods is going to be really important to try to reduce inflammation.
All right. Thank you so much, Dr. Sheetal DeCaria, integrative physician and wellness expert, for keeping us healthy and reducing chronic pain.